The vast majority of those cases and hospitalized in ICU are in unvaccinated individuals. So it's continuing to be a pandemic of unvaccinated people. Any business can introduce an immunization policy for their business and for their employees. And in certain circumstances in Ontario, we have mandated that as a letter of instruction. And we did not have a mandate in Ontario from this government's vantage point.
Ontario's conflict of interest riddled chief vaccine passport pusher recently stated that the provincial government never instituted a COVID-19 vaccine mandate, which left many who are still reeling from the effects of the indiscriminate enforcement of such government directive absolutely appalled. But stay tuned, because we have the receipts that show otherwise. Tamara Ugolini here with Rebel News, and the statement from Ontario's Chief Medical Officer of Health, that's Dr. Kieran Moore, came during a Q&A period during a panel at the Queen's University School of Policy Studies. The panel was tasked with looking at COVID at 1,000 days. The focus of the discussion was what we didn't know, what we know now, and what we wished we had of known, the expected and unexpected, and policies and principles for, get this, next time. Dr. Moore was replying to a woman who detailed a horrific personal experience of a death related to the very thing that was mandated, but who also made it very well known that other family members were completely ridiculed and exiled from society for making personal medical decisions that differed from the public health regime's COVID-19 diktats. Here's what Dr. Moore said directly in his response.
From the government's vantage point, when we asked for a vaccine policy. That policy, should have been to the point that if you don't get vaccinated, they offer, whatever the policy was, they offered an alternate to the individual. So if the school didn't want you to come to the classroom at a university or college, then you would be allowed virtual. So in our vantage point, we wanted it to be a policy framework rather than a mandate, and we did not have a mandate in Ontario from this government's vantage point. But clearly, organizations were able to adopt or modify that policy to I would assume, to their belief system or need at that time. And I'm very sorry for the untoward negative feedback that your families received regarding their immune status.
Now, the policy that he refers to is known as Directive 6, a now scrubbed from the provincial website directive that forced various public healthcare sectors, from hospitals to paramedics, to institute COVID-19 vaccine mandates. And to be fair, Directive 6 always stipulated exemptions to the policy at Section 1C, where one could complete an educational indoctrination session to seek an exemption. However, the very next paragraph allows a, quote, covered organization, end quote, to remove that option completely. And if you listen to the rhetoric espoused by Dr. Moore, you may start to understand why many did. Here's a flashback to Dr. Moore and Premier of Ontario Doug Ford, who are seen taking their masks off in between statements and responses to media during an announcement to the vaccine passport system on September 1st, 2021. Moore himself states that places which go above and beyond his supposed policy or Directive 6 with full vaccination mandates are somehow safer.
The vast majority of those colleges and universities have adopted mandatory immunization. That makes those environments safer.
Dr. Moore even goes on to allude to the fact that those who are compliant are kind, caring, and compassionate, that there will always be 1 or 2% who are noisy.
And so we have to stay kind and caring and compassionate. I think the vast majority of Ontarians are following all the rules. 83% of us who are eligible have had our first doses. The vast majority of people are going to be very compliant. There's always a 1 or 2% that'll be noisy.
And once again, Dr. Moore notes that many institutions have moved from a vaccine policy to a full-fledged mandate before discussing mandates again a few moments later.
Our initial instruction from the Minister of Long-Term Care was instruction on be vaccinated or medical exemption or education or test. That instruction will be
opened in that if there's a risk assessment that they haven't achieved the vaccination record or rate amongst their workers that they want, that they can expand it to a mandatory. As you've heard, many hospitals have done that same risk assessment for children's hospitals that serve children that can't be immunized. They have mandated immunization. So we have had a progressive approach to immunization policies in this province, some of the strongest in the world, and we will move to mandatory if and when we're not achieving the goals that we want to protect patients, children, and vulnerables in our community. Any business can introduce an immunization policy for their business and for their employees. And in certain circumstances in Ontario, we have mandated that as a letter of instruction, especially for those that provide healthcare services, but we've also done it now for colleges and universities.
Speaking a mere 3 weeks later, Dr. Moore even appears to applaud the indiscriminate vaccine mandate imposed harshly on post-secondary students. Here, look for yourself.
I know that Ontario's post-secondary education institutions have been working hard to ensure their campuses are as safe as possible, and I want to applaud their incredible efforts. I continue to urge everyone to come forward, get vaccinated, or get your child vaccinated if you have not done so already. It is not too late. There are over 640 vaccination clinics in or near publicly funded elementary, secondary, and post-secondary schools working to support increased uptake and provide accessible and convenient access to vaccines for eligible students and their families, as well as educators and school staff.
They even set the clinics up conveniently around schools to further entice and coerce those being ostracized to the actual fringe of society due to medical apartheid, preventing them from accessing and partaking in indoor social gatherings. Moore here reminds people of the next phase of that coercive vaccine program.
I also wanted to take a moment to remind Ontarians that beginning tomorrow, you will be required to show proof of vaccination when entering certain non-essential business and settings. Please take the time to download and print or save your vaccine receipts to a mobile device, which then can be used as a proof of vaccination. Prior to entry into non-essential settings, establishments will visually verify your vaccine receipt to ensure that you are fully vaccinated, along with accompanying proof of identification. As this vaccine certificate program rolls out, please, let's all remain calm and patient. There will be a learning curve for everyone, so please be considerate of each other.
And of course, this was all meant to encourage others to get vaccinated. That verbiage comes from Moore directly. Again, here, have a listen.
I do hope it encourages others to come forward and be vaccinated. 85% is a great number for Ontario, but I certainly would love us to have the highest number achievable well into the 90s. We all want to move past this pandemic, and having the highest immunization rate possible will help us get back to a new normal. So we'll monitor the situation. I do hope over the coming weeks, as a result of this policy, that we'll continue to see people coming forward for first doses.
He even went so far as to call the waves that followed the rollout of these hailed as miraculous novel injections a pandemic of the unvaccinated.
The vast majority of those cases and hospitalized in ICU are in unvaccinated individuals. So it's continuing to be a pandemic of unvaccinated people.
This is oxymoronic in and of itself, according to many actual experts who point to real-world data showcasing the exact opposite. And yet, the continued knee-jerk, non-evidence-based reaction capitalizing on pharma-funded studies and marketing campaigns was all done under the guise of protecting vulnerable people. Of course, here Moore confirms.
We need to protect the patients in that environment, give them the respect and proper care that they deserve. And part of that respect and proper care is that everyone around them should be immunized. We'll work with the institutions to try to maximize immunization. But if we're not achieving the immunization rates required to protect the vulnerable, we may have to look at stronger policies. That would be true in the acute care sector, and we've seen some hospitals, like pediatric hospitals, that care for vulnerable children under 12 years of age who cannot be vaccinated, have put in mandatory vaccination policies. to protect their patients and their families. We will leave no stone unturned to protect those that are vulnerable in our communities and embrace prevention as the means of getting through this pandemic.
Yes, they left no stone unturned, which means that if your personal medical choices were contrary to the diktats of public health, then you were fired, denied employment benefits, prevented from continuing your education, and essentially shunned from society. Moore knew this. He even said it hadn't yet sunk in for some people that they would be banned from civilization.
I think it'll increase the number of people getting vaccinated. It may not have sunk into some individuals that you may not be able to go see a football game, baseball game, hockey game unless you're vaccinated, or go indoors in a restaurant or a bar or a nightclub or any other environment that is outlined in the Act. So it may take time for it to sink in. And I do want to reiterate that we will have a progressive enforcement of this certification validation process starting tomorrow.
Modern day segregation and medical apartheid is so progressive. And they specifically targeted a demographic that was not at all at high risk of COVID-19. They simply knew that they would succumb to, well, essentially, peer pressure.
Just looking at the population that has the least protection right now, it's the 20 to 39-year-old population. They have the highest rate of infection. They have still are getting hospitalized as a result of infection and a lower rate of immunization. I think that age group that likes to go out, that is naturally social, that takes advantage of bars, restaurants, nightclubs, I think once it clicks in the coming days that you must be vaccinated to get inside, that will change behaviors.
Perhaps Dr. Moore needs a reminder from university student Catherine Bishop, a fourth-year nursing student and president of her university's Nursing Student Association, who had serious drive and real potential to become a medical doctor, who was de-rostered from her virtual university program for the intolerable act of making her own informed medical choices after both her campus and clinical placement instituted indiscriminate COVID-19 vaccine mandates. Another nurse, Louise, was forced into early retirement for making a contrarian medical decision, while the anonymous nurse who sat alongside her left the hospital to uphold her own bodily autonomy.
We were totally discriminated against, and, we as human beings and nurses, and, we have choice too, and we felt like that was we were being coerced into taking something that against our will.
And then, of course, as hospitals became increasingly understaffed, they began outsourcing traveling nurses at astronomically higher costs, often 3 times the amount of an hourly wage compared to a local nurse, as detailed by RPM Melinda Young.
It's quite a bit of money difference, and it's for them to not be expected to do the job because their training is so minimal. It just causes a lot of hard feelings. And I mean, like they're fantastic. I mean, if we didn't have these travel nurses, I mean, Lord knows our hospitals wouldn't run. But when they make that much difference than a nurse that's been working at a hospital for 10, 15, 20 years, it creates a lot of animosity on the floor.
It's the same story as healthy nurse Hetty Van Helteren and registered nurse Catherine, who tried to jump through all of her hospital's hoops to obtain a religious exemption, only to be denied, terminated, and then further denied employment benefits.
All these public health officials and these politicians are saying, like, this is for everyone's health and we have to protect everyone and we have to do this. But you know what? When you look at the World Health Organization's document on the social determinants of health, it states that the number one social determinant of health is income. So why am I being denied my number one social determinant of health?
Which is another stab in the back to tax-paying Canadians who paid into this social net safety system of employment insurance, or EI, and then found themselves ineligible due to non-compliance with COVID-19 vaccine mandates. And this happened across nearly all employment sectors, not just in healthcare, from federal and provincial government-run entities to private companies alike. And of note, Dr. Moore has a declared conflict of interest with pharma oligarch and pandemic profiteer Pfizer. He's received financial sponsorship from them and sits on one of their advisory boards.
Have an honoraria from the Ontario College, and I'm on the advisory board of Pfizer for their Lyme disease North American strategy.
The last time this hypocrite was in the news, it was for mingling maskless at a Toronto socialite event just days after advising Ontarians to mask up indoors. And now he's gaslighting you with semantics.
And we did not have a mandate in Ontario from this government's vantage point.
For Rebel News, I'm Tamara Ugolini. The ability to share this kind of content with you broadly across social media platforms will be seriously hindered by the Liberals' censorship legislation known as Bill C-11 and Bill C-18. If you think censorship works to quell democracy instead of uphold it, then head on over to our petition at stopthecensorship.com and sign it today. While you're there, you can also donate directly to us to help fund our independent journalist to help keep us afloat. That website again is stopthecensorship.com.